Thank you all so much for having me. I have had the privilege of advocating for the well-being of children and families for many years in a variety of settings. A lot of this was done when I started practicing law in juvenile court, and that was where I first really saw how many of our children, youth, and struggling parents and caregivers needed a voice. And really, that's the heart of advocacy. So I started to log the experience and receive the training that I would need to become certified as a child welfare law specialist by the National Association of Counsel for Children. Along the way, I was appointed to the Tennessee Commission on Children and Youth in 2011, actually in the same month that I got pregnant with twins, because clearly I didn't have enough on my plate. And really, that's one of the points I want to make, is that everyone has obligations in their own life. So the amount of time that you can dedicate to advocacy may dictate the route and method that you use. I love that TCCY holds an advocacy event each year in March and allows us to come together with our legislators. But advocacy is multifaceted, so I'd like to share with you some things that you can do throughout the year to support the actions and policies that will hopefully help shape the future for our children and youth. If you feel like you're spread thin, which I imagine pretty much everyone in the room would say, there are actually some really simple things that you can do, most easily by being a sponge. So you can soak up contact information for people that you meet. You can use the bookmark feature on your web browser to retain pages, articles, contacts for things related to children's issues. And then when someone mentions that they're dealing with an issue or they directly ask you for a connection, you can point them in the right direction. So I recently saw a Facebook post, which is better read than explained, so bear with me for a moment. This mother said, "Wondering if there are any therapists in the area that offer counseling to parents of special needs children. As my son with Asperger's gets older and his difficulties become more apparent academically and socially, I find myself in a constant state of worry about him, especially the social aspect. I have the ability to help him memorize multiplication tables and to capitalize the first word in a sentence, but there is absolutely nothing I can do about the fact that no one in his class talks to him. That when he tries to interact and make them laugh, most of them hold up their hand and tell him to stop. I can't explain to them how bad he wants to be their friend, but he has a condition that makes it difficult for him to fit in. I went and ate lunch with him the other day and casually asked the kids at the table what they'd been doing all day, to which they all replied, 'Math,' with a groan. Then the little girl to my left said, 'Yeah, and I had to be partners with Max, my son, and he is the worst. He just sits there and doesn't do anything, and I have to do all the work.' Then all the very honest little third graders sitting around me proceeded to let me know that he was, in fact, the worst because he never pays attention, never talks, and when he does talk, he's annoying and weird, and that nobody is his friend because of it. They weren't even trying to be mean, just stating obvious facts in their little minds. I sat there fighting back tears for a while, my mind swirling, and finally said to them all, 'I just ask that none of you are mean to him.' They all agreed, and that was that. Part of me wanted to tell these third graders about my son's diagnosis so they understood and maybe would have a little sympathy. But we haven't even explained it to him yet, and my greatest fear is that telling his classmates would backfire and they would be even meaner to him. If not now, in the future. I really need a professional to help me wade through all this. My anxiety and worry are really taking a toll on me." Reading that, I remembered a few years ago while waiting for court to convene one day, I was talking to a CASA volunteer who shared that her daughter had gone to Kentucky for a doctoral program in family sciences, specifically so that she could return to the area and other parents following that post who would also benefit from having that information. That's the thing about being a sponge. When you share what you've gathered, even a seemingly tiny drip, it can have huge ripple effects. You don't necessarily need to be an expert in all things child-related. You just need to know where to find one when you need one. And when a fellow advocate has an opportunity to affect change, support them and encourage them. They may be able to create waves of change if they just know that they're supported by other people in the field. Part of soaking up information is your ability to share it even when people don't know they need it. So you may be in a meeting where people are talking about an ACEs initiative, and there could be participants who don't know what that is yet. You may share with them that the state of California has appointed its first state Surgeon General, Dr. Nadine Burke-Harris, who is a vanguard in the ACEs arena, and that there's likely to be more national attention on ACEs in the future. And the next time those participants hear about ACEs or how California is doing under her guidance, it'll water the seed that you planted and add more emphasis to that issue for them. Stepping up your advocacy game, you might join a task force or a coalition or volunteer to be on the board of a nonprofit. You might want to write an article for a newsletter that you receive or partner with someone else to do that. Or maybe you have the skill background, the time, and the willingness to do public speaking that would make you a great trainer or to pave the way for someone who could. So a couple years after my sons were born, one of them developed autism and has been profoundly developmentally disabled. Now, I have encountered child clients with the diagnoses related to autism and had known people in my social circles whose kids were on the spectrum. But when the issue landed in my lap, literally, I started to do more research and realized that the magnitude of the autism spectrum was so much bigger than I had previously realized. So fast forward a couple years, and I was representing children in multiple cases where there was an ASD diagnosis for the child, but the staff at DCS didn't seem to understand even the basics of the condition, and that was not their fault. I had a good relationship with many folks at DCS, so I asked them to see if they had access to any kind of training about autism. And the only thing that they had was an EAP type program for people who had a family member that had this kind of diagnosis. So I called the director of their training office and asked if they had plans in place to make autism training available, at least to investigators, caseworkers, and supervisors, if not everyone. And I know the person who received that call is here today, and I'm utterly grateful for her. She said no. But then she said, "Do you know anyone who could do it?" It just so happened that I knew a phenomenal board-certified behavior analyst, and I knew the outreach coordinator for the Vanderbilt Triad Center, both of whom were more than willing, eager even, to collaborate with me to develop the curriculum and present the training. DCS said that it would have the farthest reach by making it an online program, so Vanderbilt actually donated the services of their videographer and a location for filming for a day, and we got it done. There's a few points in this experience that I want to highlight. One is to let others have the spotlight sometimes. I had been an attorney in juvenile court long enough to have unfortunately had some adversarial interactions with some folks at DCS, and I didn't want anyone to view the program, see my face, and have a negative association and shut themselves off from what they could receive from the training. So I opted not to be in the video. The second point from the experience is to be brave. You all have it in you. Before calling, I anticipated resistance from DCS because it's the state. And I felt so apprehensive about potentially having my efforts shut down. But if I hadn't summoned the bravery to face that potential denial, There's no telling how long it would have been before anyone else would have gotten this done, and how many children would have lost out on having DCS personnel who could handle their needs well. The third point is this. Be patient but persistent. This project took several months from idea to implementation, and it's like the song that was playing when I came up. It's called Shine Your Way. It's from the movie Croods, if it sounds familiar. The thing is, when you're trying to light up the darkness and you only have this tiny spark, you have to keep adding fuel and use measured breaths so that you can build the fire. As I mentioned, the unique thing about CAD is the opportunity to be advocates in the legislative process. Legislative advocacy doesn't require that you have appointments with all of your legislators every single week during session. In-person visits are great because they're memorable, but you can use letters, emails, phone calls, but however you choose to make contact, don't wait too late in the season to do it. Legislators are incredibly busy, so if you want that face-to-face contact, make an appointment. Don't try to just catch them. You're not likely to get the time you need. And if you call or write, keep it concise. You need to be prepared. You probably know your allies, but you need to know who your adversaries are too, and their arguments, so that you can be ready to counter them. Money matters. Your legislator may point out the fiscal note for a bill, but if you can address the long-term cost savings through healthcare, corrections, or other areas, then you're going to be able to keep that conversation open. If you need to gather information to answer a question, tell them you'll get back to them and make sure that they have your contact information. And keep in mind that passion may make your fire burn brightly, but without reliable data to fuel it, it can burn out and be dismissed. Never exaggerate or say something that you don't know is true, because you'll lose credibility, which can be really hard to regain. Keep in mind that you can find policy briefs and really excellent data on TCCY's webpage to help you through that legislative advocacy process. And I know I'm out of time, but my one most resounding thought on children's advocacy is a simple one: don't give up. I have, for a number of reasons, transitioned to another job, but I still find ways to be a children's advocate, and I love every minute of it. I wish you the best in lighting the darkness wherever you find a chance. Thank you.